Hello everyone, welcome to e-classes by Dr. Adira. This video is on Sjogren syndrome. Sjogren syndrome is a chronic systemic autoimmune disorder that principally affects salivary glands and lacrimal glands. And it results in xerostomia or dry mouth and xerophthalmia or dry eyes. The effects on eyes can also be termed as keratoconjunctivitis sicca, where the word sicca means dryness. Moving on to the types of Sjogren syndrome, there are two types as primary and secondary Sjogren syndrome. The primary Sjogren syndrome affects salivary and lacrimal glands and causes xerostomia and xerophthalmia, and there is no other associated autoimmune disease. Whereas in secondary Sjogren syndrome, in addition to involvement of lacrimal and salivary glands, there is also another associated autoimmune disease, which might be either rheumatoid arthritis or systemic lupus erythematosus or scleroderma. Since primary Sjogren syndrome involves only salivary and lacrimal glands, this is also known as sicca syndrome, where the word sicca means dryness. So since it causes xerophthalmia and xerostomia only, the disease primary Sjogren syndrome is also known as sicca syndrome. Etiology of Sjogren syndrome is not very clear, but it suggested that viruses like Epstein-Barr virus, human T-cell lymphotropic virus, etc. might cause this Sjogren syndrome. And also it is found to have some genetic influences because relatives of affected patients have an increased frequency of other autoimmune diseases. That's why, since this familial tendency is present, genetic influence is also proposed as an etiological factor. Moving on to the clinical features of Sjogren syndrome, it commonly affects middle-aged adults with a very high female predilection. It is found to be 9 times more common in females than males. So it's similar to any other autoimmune disease in this regard. And I said it principally affects the major salivary glands and lacrimal glands. As it affects salivary glands, it might cause enlargement of salivary gland, that too usually bilaterally, as you can appreciate in this image. The enlargement may be appreciated in 1/3 to 1/2 of the patients affected with Sjogren syndrome. And the swelling or enlargement may be slightly tender or even painful, and pain if present may be intermittent or even persistent. As I mentioned already, the primary Sjogren syndrome is not associated with any other autoimmune disorder, and it affects the salivary and lacrimal glands only. As it affects the salivary glands, there is reduced production of saliva causing xerostomia. As you can see in this image, the oral cavity, the salivary secretion is less and the residual saliva appears frothy, and reduced lacrimal secretion or tear production causing xerophthalmia or dry eyes. And the secondary Sjogren syndrome is associated with other autoimmune conditions as well. That means there is sicca syndrome, that is xerophthalmia and xerostomia. Along with that, there is presence of other autoimmune conditions as well. And it is found to be present, that is Sjogren syndrome is found to be present in 15% of patients affected with rheumatoid arthritis and 30% of patients affected with systemic lupus erythematosus. So these are the common autoimmune conditions seen associated with Sjogren syndrome. The principal oral symptom of Sjogren syndrome is xerostomia or dry mouth as a result of reduced salivary secretion. And the residual saliva appears frothy, as you can appreciate in this image, and there is lack of its usual pooling in the floor of the mouth. As a result of xerostomia, there are various secondary manifestations or secondary complications like difficulty in swallowing, altered taste sensation, difficulty in wearing dentures, fissuring of the tongue with atrophy of papillae, as you can appreciate in this image. And there is erythema and tenderness of oral mucosa due to development of secondary candidiasis. As you can see here, there is white patches in the oral mucosa, which is secondary candidiasis, which develops as a result of xerostomia or dry mouth. And there is lack of cleansing action of saliva, which causes the very important, very characteristic complication of xerostomia, that is dental caries. And the dental caries that develops due to xerostomia typically affects the cervical third of the crown, that too all the surfaces, all the four surfaces in the cervical third of the crown. So in this fashion, the dental caries might result, that is cervical caries might result in the amputation or loss of the rest of the crown portion. And another feature, another complication of xerostomia is that is reduced salivary flow rate might cause retrograde bacterial sialadenitis, that is inflammation of salivary gland due to retrograde spread of bacteria. Now let's see what are the ocular manifestations. Reduced tear secretion or lacrimal secretion causes scratchy or gritty sensation or feeling of perceived presence of foreign body in the eyes. Along with this, there will be also defects in the ocular surface epithelium because of inflammation of the ocular mucosa. These defects together are termed as keratoconjunctivitis sicca, that is ocular manifestations of dry eyes, that is xerophthalmia, and defects in the ocular surface epithelium together are actually termed as keratoconjunctivitis sicca. And because of the persistent inflammation, there will be blurred vision and aching pain. These symptoms are usually least severe in the morning and increases as the day progresses. The inflammatory process in Sjogren syndrome also affects other tissues of the body. So there is presence of dry skin, usually dryness of nasal mucosa. Along with it, fatigue and occasional depression is also manifested. Now let's see what are the investigations or methods to identify Sjogren syndrome. Various investigations include xylography, and there are various tests to assess xerophthalmia or dry eyes. Then there are blood and serological examinations and biopsy. So if you see a xylographic image of major salivary gland affected with Sjogren syndrome, you don't find the normal branching or normal arborization of tactile system. You don't find it here. And there are areas of punctate cyalectasia. These are the areas of cyalectasia or ductal dilatation which appears as these punctate areas. And this overall appearance thus gives a pattern or produces a pattern termed as fruit-laden branchless tree appearance or fruit-laden branchless tree pattern. There are two tests to assess keratoconjunctivitis sicca or ocular symptoms. The first test is known as shimmer test, which is done to assess xerophthalmia. In shimmer test, a filter paper, as you can see in this image, a filter paper is placed in the margin of lower eyelid between the medial and lateral thirds of the lower eyelid, and the wetting is assessed after 5 minutes. This is placed in an unanesthetized eye, that is without giving any local anesthesia. And after 5 minutes, when you check the wetting, if it is less than 5 mm, that is indicative of xerophthalmia. Similarly, I also told you there are manifestations or there are defects in the ocular epithelium as a result of persistent inflammation. That defects in the ocular epithelium or defective ocular epithelium can be visualized using this dye known as rose Bengal dye. So rose Bengal dye test, if done, will show if the ocular epithelium is defective, as you can appreciate in this image. So these two tests are done to assess the ocular symptoms. Moving on to blood and serological investigations. As in any other autoimmune disorder, the erythrocyte sedimentation rate is usually high in patients with Sjogren syndrome, and there is elevated serum immunoglobulins, especially immunoglobulin G or IgG levels. And there are specific autoantibodies like anti-SSA antibody and anti-SSB antibody, that is anti-Sjogren syndrome A and anti-Sjogren syndrome B antibodies, especially in primary Sjogren syndrome. And usually they are seen in 40% of cases. Anti-SSA is seen in 40% of cases of primary Sjogren syndrome, and anti-SSB is seen in 25% of primary Sjogren syndrome cases. And there is presence of another factor known as rheumatoid factor in about 60% of patients affected with Sjogren syndrome. The presence of rheumatoid factor is irrespective of whether the patient has rheumatoid arthritis or not. Even if the patient doesn't have rheumatoid arthritis, in Sjogren syndrome there may be presence of rheumatoid factor. Similarly, anti-nuclear antibodies are also present in 75 to 85% of cases. Coming to histopathological examination, if you do a biopsy of salivary gland affected with major salivary gland affected with Sjogren syndrome, we'll find acinar destruction, that is destruction of salivary gland acini with intense lymphocytic infiltration. But for diagnostic purpose, usually biopsy is taken from normal tissues of lower lip to examine minor salivary glands. So for this purpose, 1.5 to 2 centimeter incision is made in the lower labial mucosa parallel to the vermilion border and lateral to the midline to get 5 or more minor salivary glands. So after obtaining the specimen, it is stained and examined under microscope for the presence of lymphocytic foci. When we say lymphocytic foci, it should be collection of more than 50 lymphocytes adjacent to normal appearing minor salivary gland acini. So if you find more than one such foci in 4 mm square of glandular area, that confirms the diagnosis of Sjogren syndrome. So this is the minor salivary gland biopsy test done for the diagnosis of Sjogren syndrome. So that's all about the investigations of Sjogren syndrome. Now let's move on to the treatment. So treatment of Sjogren syndrome is usually symptomatic. For xerophthalmia, to relieve the symptoms or difficulties produced by xerophthalmia, we will have to provide artificial tear secretion, and to relieve the symptoms of xerostomia, artificial saliva, that is salivary substitutes, and sugarless candy can be given to stimulate the salivary flow. And oral hygiene, maintenance of oral hygiene is very important. So use of oral hygiene products containing antimicrobial substance like lactoperoxidase, lactoferrin, etc. can be given. Then xylocope medication or cholinergic drugs like pilocarpine can be provided to increase the salivary flow. To prevent dental caries because of xerostomia, as a result of xerostomia, it is advised to give fluoride application to the teeth. And if there is presence of secondary candidiasis, antifungal therapy can be initiated. Another interesting fact about Sjogren syndrome is its risk of development of lymphoma. It is found that patients with Sjogren syndrome has 40 times higher risk of development of lymphoma than normal population. This lymphoma here is usually a type of low-grade lymphoma, that is low-grade non-Hodgkin B-cell lymphoma or mucosal associated lymphoid tissue lymphomas. The risk of development of lymphoma in patients with Sjogren syndrome can be assessed using immunoglobulin gene rearrangements in labial minor salivary gland biopsy. This can be thus used as an important marker to know the risk of development of lymphoma in Sjogren syndrome patients. So that's all about Sjogren syndrome. Thank you for listening.